Here, Rob, this is going to help out a little more too with your screen. And I stopped doing the screen share because I have a presentation I was going to go. Well, you know that. That's
Yes.
why I wanted to get
This
in.
is why I'm here. Yes.
Yeah.
If she's new, it might just be better if we talk.
Well, I can
for
go.
now.
No, she wants me to read it. This is one of the things she was like adamant about because the topic was a real good one for her. That's I remember her saying that yesterday.
Yeah, because I never see this topic out there.
No, it needs to be addressed. I mean, we've been doing this for me and Susan been doing this for 19 years. But those of us that
I don't see Susan.
she's sitting next to me.
She's blurred.
Oh, hi, Susan. I was looking for another screen.
Nice meeting you.
Yeah, she
Nice to meet you.
we've been doing this a long time and it's a common topic and we see it, but nobody really addresses it. So I wrote up this presentation a few days ago and I thought it'd be beneficial for people to learn. And everything that we do is about self-help, you know, instead of so you can live and learn and get better over time instead of just going to the doctor's not going to fix nothing aside from a diagnosis. They'll tell you what's wrong, but they don't tell you how to.
Don't even get me started on the doctors.
Right. You know, that and pharmaceuticals, we don't,
Yeah.
That's a whole nother, that's a whole, there's a political end to that too, all of that. No, we don't get involved in that kind of stuff. So, yeah. You know what? I'll go over this. I'm going to read this. I'm not going to, normally I was going to mute everybody, but I think that we're all well behaved. So I'm not going to have to do that.
Well, let me stop you there. You might want to mute me because sometimes I do just open my mouth. So if you have to, don't worry. I'm not going to be offended.
It's okay. I'll go, Jessica, stop. Jessica, stop.
Time out.
Good luck. I don't listen to
I like-
myself.
I like to mute in case my phone rings because I
Yeah.
can't really stop it and I don't want to
right.
encroach. So I'm going to
Okay.
mute myself.
All right. No, I'll mute everybody. I'll just go down that road. I'll just-
Okay.
it makes it. I just thought I could make a nice, funny joke because we all know each other. And good one. Okay.
Hey, you can make any jokes.
We all are laid back. Like I like to be professional, but we all have a good side and funny side, and we're silly. I don't like to be too formal. We're all survivors and caregivers, so we get it. Just have a good time. That's really what it's all about.
Okay. Thank you so much.
We learn and we help each other. Yes. Okay. And I'm going to go over the details in the presentation too. All right. Here we go. All right. So I'm going to close that. All right. So here's the timeline. Normally, the opening 20 minutes, we say hi and introduce ourselves. We talk about our experiences and what brings us here. The introduction is a participation agreement that I'm going to go over that talks about the rules of the calls and what we do and why. Then we have the discussion of the topic this week, which we all know about. And then at the end, we make time available so we can just openly chat. We can talk about what we went over, ask questions, talk about our experiences, and get to know one another, share contact information and all that good stuff. We all consider each other, we're family. We're going down this road and we all understand the struggles that we go through. So nobody understands like a survivor. And a caregiver is like June's wonderful. She's got a wonderful open mind and she's all about learning. And we all built a wonderful relationship with her as well. Her husband had a brain injury recently and he's hospitalized now and he's starting to come home every now and then. So, and the rest of us all had we were all survivors. I'm a caregiver as well. And Susan's got the social work aspect of it. Barbara's got the medical experience professionally as well. Julian was a teacher and so was I, and I got the medical background too. So it's like we all touch base together. And we overlap each aspect of it. All right, next slide. Here we are. Of course, we all know what this is, me and our organization. Okay, here we go. I just edited this today. We're here as a peer support group for survivors, families, friends, and public education about neurological impairments and brain injuries. You do not need to be a survivor to be on our calls. Anyone associated with neurological issues is more than welcome to be on our calls. Our goal is to assist one another with our knowledge and experience to help one another. Be mindful that which means an open mind, because we all can learn and help each other. You all know this. I just put this up on this presentation. It's on the video that I just posted on Facebook. It shows the time differences because that's a common issue, is people don't know what time is this meeting. So I put this on here of the different time zones and things like that. Yeah, and then we were just joking about time zones and the Philippines and Australia. I keep screwing up because we keep changing the time zones here in the US, which is annoying. All right, next slide. The support call, this is the participation agreement. Calls are recorded for the protection of members as a business. Recordings are not shared without the consent from everyone on the calls. If one person says, please, I don't feel comfortable sharing my personal information, I don't share it. You know, we all open up to each other. We talk about our personal lives together on here. So if somebody, you know, wants to keep it private, that's totally respectful. Normally, please prepare to be on time or early when the meeting begins. And especially if you're new, understand the time zones and all that kind of stuff can be an issue. But when we have a call in session and there's a lot of people on the call, I can't invite people to come in later and interrupt and start over the whole conversation and introducing themselves and all that kind of stuff again. So after 20 to 30 minutes, you know, it's a little too late and I can't let you in the call. The important thing is we stay on topic with conversations, unless we have, of course, open mics, which we do often too. So we could just have fun and be ourselves. We do not discuss politics, religion, or sex. Everybody's got their opinions and it goes off the hook and people get offended and all that kind of stuff. So no, that's a big no-no. Please be patient. One person speaks at a time so we don't talk over each other. Usually just common consideration is really the key. We're here to be supportive of one another without any judgment. If I start seeing people pass judgment on each other and getting offensive, I easily just remove you from the call and you're done. That's it. We are not therapists, although the calls have been very therapeutic for each other. We get a lot of thank yous about how wonderful the calls have gone and how we help people out. And that's the whole idea of what we do here. I mean, some of us have the background, so we know the routes and how to help each other. So that's that with the participation agreement. This is the topic we're going over today. It's self-help and self-control, recognizing impulse control and disinhibition. I hate that word. I keep getting little, but I wrote about it and I hope this is helpful. It's very resourceful. I do have credible resources I get this information from, and also experiences that I've been through as a teacher for children with special needs and doing adult help as well, professionally and personally with one-on-ones with people. So I'm going to go over definitions. That's going to be the first half of this presentation. And then we're going to go over some things about self-help and how you could help yourself with these things. So here it is. The frontal lobe of the brain is responsible for executive functioning, including controlling impulses. Damage to the frontal lobes and reduced ability to control impulses can be caused by trauma, alcohol and other drugs, dementia, other types of brain disorders, and mood disorders. This is one of the things I want to make clear, because of frontal lobe issues don't have to come with an impact. They can be through medications, they can go alcohol, anything that's a deterrent, you know, with your brain function can cause, and especially extensive drugs and alcohol can also create major issues with frontal lobe functioning in the brain. This inability to control urges can lead to impulsive and inappropriate social behavior. For example, a previously shy person may become quite extroverted and talkative. In more severe cases, a normally reserved person might make crude or sexually inappropriate comments to strangers, or any inappropriate comments to strangers, which I'll go over. When others don't understand how brain injury can cause impulsive behaviors, it often leads to rejection and criticism. Social isolation can result as existing relationships break down and there is an inability to form new ones. We have hidden disabilities and people don't understand why somebody might be acting or saying inappropriate things randomly because they don't see it. And that's important for us as survivors to understand. And of course, it's public education that there might be an issue. And that's why it's a popular thing to have like these, there's disability cards, you know, identification saying I have a brain injury or, you know, those types of things. Some people don't like to portray that, but some people need to, especially if they have a history of these issues I'm going to go over today with impulsivity. So, common features of impulsivity. Some of these I'm going to go over again. You'll hear different words and different phrases that I'm going to use, but it's just to become more familiar with the terminology so we can understand ourselves better. The common features are acting without thinking, inability to save money or regulate finances, irritability and temper outbursts, being too familiar with strangers and sharing very personal details, asking personal questions that cause discomfort, yelling out answers before questions have even been completed because you get overexcited and you want to get what you want to say out before you lose, you know, the thought process. Intruding and interrupting conversations with kind of go hand in hand with the last one. And unable to wait patiently for their turn. And another one is sexual promiscuity. Now, this isn't limited. There's other things that become an issue, but this is the general common features of it, of impulsivity. Another common problem is lack of insight, knowing where you might be wrong in what you're doing or, you know, the impulsivity. Another common outcome from a TBI is lack of awareness. The person may deny their behavior is impulsive, fail to see the consequences of their actions, or understand how someone else is feeling. Disinhibition. A common change early in recovery is disinhibition. That is loss of control over behavior resulting in socially inappropriate behavior. It's a bigger, more complicated word to explain the impulsivity. This ranges from a tendency to divulge in personal information too freely to disturbing and unpredictable outbursts of uncontrolled rage. Common complaints include a tendency to make tactless remarks, to laugh inappropriately, and to be overfamiliar towards others. A major area of difficulty, especially early in recovery, is that of sexual behavior, making inappropriate sexual advances or remarks. Abusive or crude language may cause offense and be actually embarrassing for relatives or in other social situations. Most common gradually regain control over their behavior, but those with a severe injury may remain impulsive and or inappropriate in their actions. A few people never regain adequate control of their behavior, remaining unpredictable, aggressive, and reliant on others to exercise a degree of self-control over their own behavior. Again, this is a big one with self-awareness and self-reflection, knowing, okay, something happened, you know, we all make mistakes, you might have done something wrong, but being aware of it, reflecting on it, and knowing that you have to stop acting that way is where it has to begin. Now, this one here is impulsiveness. This is the actual definition of that. A person with a brain injury may tend to speak or act without thinking about the possible consequences of their behavior. And now this is not just traumatic brain injuries. I want to make this clear. A brain injury is anything outside of a normal brain function. Working with children with autism, impulsivity is a major issue. People with acquired brain injuries have this problem. People with brain tumors, brain cancer, this can be an issue. All of these things are different areas. And it's also, like I said earlier, is about drugs and alcohol as well, because they cause neurological impairments. This can lead to embarrassing and social situations, such as if they say an inappropriate remark or without thinking, it might upset the person they're speaking to. In other circumstances, it can lead to practical difficulties, such as if they agree to do a task they're not realistically able to complete, or if they spend more money than that can be afforded. There's a lot of different scenarios that this comes into play. Obsessive behavior is a common, that's part of impulsivity as well. A person may become obsessive or fixated on certain thoughts or behaviors after a brain injury. For instance, they may be afraid of their possessions will be stolen and subsequently check their belongings repeatedly, or they may insist on a particular routine or things being done a certain way. That is so, like, routine is big, especially after we have a brain injury, and routine is very, very important with structure and getting in a routine of things so we can get our lives back in order. It can get obsessive because if there's a break in the routine, you feel lost, you feel frustrated. What am I going to do? And especially when other things come into play, like distractions and multitasking. So obsessive behavior is a very, very common trait with causing problems with impulsivity as well. Now here's a little bit bigger one, and I got some quotes from a neuropsychologist that I want to address. Again, this is for the educational part of this presentation. So I'm going to read it in full detail so it's easier to understand. And some people have issues with visually, and verbally I'm going to, so you can hear it better and it's going to come over better for some people. It goes both ways. Perhaps the most common behavioral change after a brain injury is that of increased irritability. People with a brain injury are often impatient, intolerant of others' mistakes, and easily irritated by interruptions because of their loss of thought, like they're worried about that. But other things such as noise and other distractions from children and machinery, which disrupt their concentration, like a phone call, something happens, all kinds of environmental issues. They are frequently reported to be short-tempered, for example, when things do not work out as expected, or where there are difference of opinions with family or work colleagues. Where this is associated with poor behavioral control, it may result in outbursts of verbal and physical aggression. Anger, this is by Dr. Gemma Elliott, clinical neuropsychologist and trustee of the Headway. And actually, this is they're in Australia. Anger is one of the many emotions which can be expressed differently or be less controlled following a brain injury. Many factors may underlie the changes, including but not limited to damage to the frontal lobes and limbic system and overstimulation. It is also important to consider the impact of factors such as social circumstances, previous personality, and the balance between the current demands and resources. Development and understanding of what is going on for each individual is essential in order to direct the type of support and intervention required. Whilst hints and tips can certainly be useful, but there is no one strategy that'll work for everyone. Neuropsychologists may be in a position to assess and advise. As well as being distressed and confused for the person themselves, altered emotions can have a significant impact on those close to them, the environment, and the people. Support should therefore be directed towards both the individual and their families, because you need an understanding on every side to be able to help each other, not just the survivor, to help families and loved ones that are around as well. Sometimes developing the understanding of others and altering their responses can be the key to moving forward. That's a big one. I love this whole thing that they had wrote because we talk about this all the time, is having a positive environment around you and mutual understanding from both the loved ones, the caregivers, and the survivors to build a positive environment for everyone to be able to understand and move forward together in a good way. Everybody can enjoy the lives together. Another issue with impulsivity is apathy and a loss of initiative. It can go both ends of the spectrum. Either it goes too far or people become very reclusive as well. Some people may become passive, unresponsive, and lacking in initiative after a brain injury. They may appear unconcerned and even unaware of their difficulties, especially in the early stages of recovery. Others may appear interested and have good intentions to carry out activities, but are unable to organize themselves and initiate the actions. This may happen to any of us when feeling depressed, but for the person with a brain injury, this can also result directly from the injury itself rather than solely on a result of depression. It doesn't have to be a mood. There's a physical aspect to it. Egocentricity. This is an interesting one. People may also become egocentric after a brain injury, tending to be self-centered and appearing not to consider the feelings or needs of the family and friends because they become so focused on themselves and what's going on in their brain. In adversity, it is most common for anyone to tend to focus on their own needs, but this can be greatly exaggerated for a person with a brain injury. Cognitive impairments can mean that they are oblivious to or unable to appreciate other people's points of view, and they are unaware of the needs of others. And I'm going to lead forward to how you can help fix those things. In the next slide, self-help. Think before you make your next move. And a big one, and I didn't put this on there, but it just popped in my head, ask questions. Everything is about communication. People should be on any aspect of it. Ask questions and answer each other patiently and open-mindedly. That's a big one. To help managing impulsivity and disinhibition. This is a quote that is funny, and I hear it all the time. And I've done it myself. I can't help it. By the time I thought about the comment I already said, the damage is done. This happens very, very often. But some people want to fix it and some people don't even bother. Point is, they should, because this is the people that are involved in their lives, and we need help and they may need help to understand. Following a brain injury, a person may be left with issues of impulsivity and disinhibition. For example, they may speak without thinking through the consequences of their words, laugh at inappropriate moments, or engage in dangerous or costly activities without the consideration of negative impacts of their action. You know that phrase, every action has a negative and positive reaction, always. Managing disinhibition or impulsivity can be a challenge because of the spur of the moment nature of the issue, can make it hard to plan and develop coping mechanisms. We ask our followers on social media whether they or their loved ones experience impulsivities following a brain injury. We received an overwhelming response showing that the issue is widespread and difficult to manage. From those responses, we put together some advice for coping with impulsivity and disinhibition after a brain injury. And this is why we're doing this presentation. Coping strategies, developing coping strategies. While some aspects of impulsivity and disinhibition are hard to predict and manage, there are ways to reduce the impact that it has on everyday life. Take your time before you speak, and think of others and the consequences that may follow. Like if you're saying something, think about, where is this going to get this conversation? Where is this going to get me? And where is this going to go with the other people I'm talking to? reaction, you know. Trying to take some time to think things over before you speak. Step back, walk away, think it over in your head. Am I being reasonable? Do I really truly feel this way is the socially acceptable way to feel? If you answer no, you must keep it to yourself. This is the hardest thing you'll have to do. If you're a friend or a family member of a brain injury survivor, you might be able to help to identify when they're acting impulsively, inappropriately. Talk to them, like I was saying, you can ask questions. Is this a time and a place for this, or can we deal with this later? You know, would you mind like an apology, or, you know, their opinion, and then have a conversation about it either then or address it later. But it's about helping each other. Now here's another part, and this is funny because there's things that sometimes, depending on the level, self-help can, if you were still having a problem, it might be a problem to use techniques to help increase awareness and thought before acting. This is something you should speak with your doctor about, as that might be able to refer you to someone who could help, such as a cognitive behavioral therapist or a neuropsychologist who are aware of these issues, especially somebody who's familiar with traumatic or any kind of brain injuries. There are doctors out there, psychologists that are out there, neuropsychologists that aren't aware of brain injury issues, although they should be. They just don't have the experience because you look fine. So that's a big one. Some things you might need a medication just to calm yourself down, especially if you're going to be in an environment where there's going to be a lot of distractions, a lot of people, a lot of stimulating things going on around you. There are coping strategies for each one of those types of things. Or you might just want to avoid them until you start feeling better and you have some more self-control, whether it's with the help of therapy or a medication if needed. And that's it for the presentation. We can go any of these types